Good morning, everyone. Welcome. We're really lucky today to have with us Monique Sanfuentes, and her title is, she's the Director of Community Health and Wellness at Suburban Hospital. And I found talking to her really fascinating because I tend to think of hospitals as a place you go when you get sick or injured or to visit someone who's sick or injured. But in fact, in her position, which she's held for 17 years at Suburban, Monique's job is primarily to work to ensure the health and safety of the community outside the hospital so that people don't have to get admitted. And there is such a wealth of programs that Suburban runs under her leadership that works with other hospitals, that works with community groups, that works with associations, hopefully with churches, faith communities, to help keep our community safe and well so that they don't have to end up in the hospital. That's one thing that's fascinating, which we'll hear from her about. And the other is that, we've heard this before, Montgomery County is such a diverse place. We've got an amazing array of needs, unidentified needs, and barriers to cross in the health area, as we do in so many other areas. Everyone wants to live in Montgomery County because it's a wealthy place, great jobs, great schools, and we have such a diversity of needs in the community, and this is something else that Monique is focusing on. So this morning, I think we're going to learn things that we don't know about Suburban and the role it plays in our community. And with that, I'm going to stop and introduce Monique Sanfuentes, and she has a few slides to show us, then we'll do a little conversation and then questions. So thank you.
Good morning, everyone. It's a pleasure to be here. I am a friend of St. John's and have family members who've been very active, and my 3-year-old is running around your library right now. So thank you for welcoming all of us. And it's really, it's wonderful, and as I've been speaking with Anne, with Langdon, that you're taking this journey and taking the time. And as Sari says, the time is impressive to hear all of the different major organizations and initiatives going on in Montgomery County. I started living in Montgomery County in the 7th grade, and I am a native Washingtonian, born in Washington, D.C. So I had the opportunity, though, to grow up here, to go to school here, to work, to leave, to live abroad, to come back. And you know what always motivates me in everything I do is people, and people that are teaching you something, whether you're learning something good or bad. You say, okay, this is what I want to do, this is what I'll remember not to do. And I think that so much carries on, and what is such a privilege for me in my work at Suburban Hospital, where the day I started was never going to work. It was just living and serving because our community is so appreciative. And I am thankful to be able to get those thank yous, get those hugs that a lot of times I tell my colleagues, the clinicians, the medical providers, come with us and see, so you can have this perspective of the great work that you do that puts our community in such a great place. What I wanted to share with you today is just a very brief background of the kind of work that we do to make sure that we actually are aligned in the work that we're doing with health improvement. As Anne mentioned, every waking moment that I have is about keeping people out of the hospital. Anyone who comes to the hospital, it's their choice for education or to learn something. And then that also it gives us an incredible opportunity to work and partner with others in the community towards that greater good. Suburban Hospital is a nonprofit organization, so we are extremely committed and feel very responsible for having that component of what we do. And I think this connection also with the work that St. John's is doing just says that we're all thinking about no day is a day to take for granted, and how we can make that better for others. So we conduct every 3 years a community health needs assessment, and I wanted to give you a little bit of a background on how that data has come together to form the work that we do. Just like the sessions that you're holding here is like your assessment, right, of what's going on, to take all of that data to bring it together. We do something very similar to make sure that we're aligned and we're able to actually measure the work that we're doing, that it actually has changed. So I start with that deliberate approach. And this is, I always say, a snapshot. taking photos, showing what that work looks like, it always tells the story the best. And then I wanted to just also briefly show you, when we're looking at that collective impact, much of, and you'll see right here, as far as all the work, faith-based organizations, it's not just one organization alone. So I think this is a great way to get started. When we look at how we have that collective impact, and that's not just shaking a hand and saying, so nice to meet you, let's do something together. It's actually getting the work done. But we know that with all of us, we can't do it alone. Not our place of work, not just our neighborhood, not just one faith-based organization or one hospital or one government. It's everyone working together towards that cause. And so I'm going to take you a journey with a word that I use a lot is population health. For those of you maybe not as familiar with public health, population health, I think that is one word that really sums up everything we want to do, again, to improve lives. It's taking lots of different pieces and bringing them together. So the slide that you see is a picture of our neighborhood, of our community, and every little piece of what is happening in that, how that affects someone else's life. And if you look at this, let's say from a neighborhood view, this is what it looks like, let's say back at the ranch, back at my shop. Who's around the table to help us do that work, to take care of patients in our community? Whether it be those clinical providers, always in the center is the patient, which we would say here, always in the center are those who need us the most. And then when we look at, I'm just going, different programs that the hospital does. This is just to give a little background. Last year, and FY 15 and 16, I know data hot off the press, we're about $21 million in our community benefit, meaning dollars and programs that we invest back into the community. What I want to tell you, though, that is not suitcases of cash. That is in people's time. And that is in volunteers, people who work at the hospital who give back, and initiatives that we take in advance to make sure that we're measuring that impact. And so this is just to give you a little bit of that background. And you might hear a little bit in the news about accountable care organizations. With the Affordable Care Act, this is something when we look at what moves the work that I say we've been doing all along in health improvement and community health and wellness, this kind of gives that very formal outline to that productive work that we're doing from, let's say, the inside doors of the hospitals to the outside doors of the hospitals. And what that means is one reason I'm here today, because it's not just about coming in, let's say, for an emergency or scheduling a surgery and going home. So as I say, it's not at the door saying goodbye, we hope you're well. It's about the full circle of keeping everyone close so that we're always in good communication, which is key to know how we can help each other the best. And what that is starting a little bit of that line of how do we stay connected with our community. And what I'll talk a little bit about aging in place. And I know there have been many speakers here before that have touched on bits of this. And that is, what are those factors that impact population health? And when I, let's say, give this presentation during the first day of orientation for our employees, I know I get a lot of folks who say, well, Monique, what does employment or education or housing have to do with my work at the hospital, if I'm at the bedside, or if I'm just focusing on their success of going home or getting them registered? Well, everything. And that is what I have to say is our journey, where our journeys come together, is about ensuring that everyone understands that it is every indicator and how we all become responsible for that quality and length of life and what we're working towards. And so what I wanted to do is to show very briefly that there is a formula for doing that and conducting the health needs assessment that I mentioned earlier. I'm not going to go into great detail. This, again, was to just give a little bit of an outline of when you think of what are the pieces of the puzzle that bring you to where you want to go with your outcomes, with how you want to make that impact into the community. When we look at taking input from the community, taking what the county and state health statistics tell us, what our actual hospital for us utilization is, what the priorities are of our health department, and then take what we actually do well, we get a formula for how we identify health priorities. So St. John's, for instance, might have, you know, a different formula for how you get to that. This is just one example. And so when we do, I wanted to give you a backdrop of the core measures of Healthy Montgomery, healthymontgomery.org. You all live in the county. If you're ever looking to learn more about different health indicators and where we are, you can always go onto that website. And this is how they actually measure the health and impact of how we're doing in our county with a red, yellow, green little barometer, and how we also share our information to contribute to that. St. John's could also be contributing to that, all of our community organizations. When we, you know, a few of those statistics that brought us to our health needs assessment, when we look at, you know, what brings people into the hospital to help us say what helps keep them out. Again, I'm not going to go over a lot of this in detail. We're looking at the top causes of death with our health needs assessment. We're looking at top causes of death by race and ethnicity in the county. This I wanted to just show you what comes to the top: cardiovascular disease, what we would have is cancer, diabetes, chronic lower respiratory incidents, and accidents. So you think of this area, lots of transit, lots of cars. Those would be, for the county, what we're looking at and what we're up against. When we, and as we're looking at that, we also say, where do we decide with our community where we're going to start? This is one example. And these zip codes here are the final, what we call our community benefit zip code area of where we're focusing a lot of our initiatives and programs. Stand off to the side so everyone can see that. And that formula I shared with you earlier is a way to coming to those zip codes. Does that mean if someone gives us a call or we have a partnership with someone outside of that zip code area? Absolutely. But where do we know we're focusing a lot of our efforts? We have one, you know, a signature, a map to help guide us. And again, this is an example. So quickly we'll go through, I had mentioned that the survey that we had conducted to get a lot of the data for our health needs assessment. We actually went out to gas stations, Home Depot, grocery stores, the 7-Elevens where a lot of our workers are looking for day work, and actually asked with folks, engaging, going up and saying, sir, may I ask you 10 questions, and actually get that information. So we didn't hand it out on paper for people to just give back to us. We actually went through those questions, and this is what we got back, and in the percentage. So we're, you know, one of the reasons when we're looking at that zip code data, look at those numbers up there, and I know it's hard to read. What do you see? What are you makes you think of these different numbers in these different areas of where we live? What is a conclusion you might draw by those numbers? Our community is aging. Yes, our community is aging. And in this area, we have the highest age expectancy rate in the lower to middle 80s, which is amazing. But that tells us something. What are we doing then with our aging population to make sure that they're healthy and well and live with dignity? So this is something that we looked at. So very quickly, when we go through, and this is to share with you that might be helpful or interesting, of the surveys that we received back, when you look at for our department, age-adjusted emergency rate due to diabetes, and look down here at the zip codes. When we're looking at the zip codes where we don't see as much of the prevalence of diabetes for those coming into the hospital with those who have more, again, we start to see a story. Here we're looking at our Chevy Chase, Bethesda zip codes. Over here, Silver Spring, Gaithersburg, a little bit in Rockville, depending like right on that line. So you start to look where people live, what different kinds of diseases they may be faced back with, and those indicators that we talked about. So percentage of people aged 25 and over with a bachelor's degree. You start to see a story here, right, with those zip codes and those who have education levels. again, just to give you an idea, perceived health risk of those surveys that we took. Look what comes to this here. 33% did not feel that they are at risk. Then you have diabetes, cancer, heart disease, other than obesity, behavioral health, and those who did not fill it in or did not want to answer, to give you an idea. Top barriers to better health. Let's go back to the bottom. 42% say they actually don't have barriers. Cost, 28% having no health insurance, lack of time, very busy community, and lack of information. Top 5 health concerns. We have diabetes, high blood pressure, then you see cancer, heart disease, and obesity.
Is this self-reported?
This is all self-reported. So these are individuals, and I will tell you a little bit about the population. And so if you look at the zip codes, and feel free if you have questions as you see any of this data, let me know. With the different chronic diseases, and that came to the top, the zip codes where they really came to the top, most reported. And then this is what I love. What story do we see from all of this data?
Monique, how big was the cross-section that you were interviewing?
So there were 500, and then we took, of the zip codes where we deliberately chose from our identified community benefit service area, there is a statistical formula that you can do to make sure that you're representing the evidence-based a percentage enough to make sure that you're getting the appropriate cross-section of the data. We made sure that each of those percentages for those zip codes were achieved. And that we didn't stop until we achieved it. Otherwise, the data isn't as powerful. So thank you for asking that. To make sure that it was significantly, that the data was significantly in that we could measure it. So we'll talk a little bit more, I think, and probably in our conversations about this. And so I'll move on. And this, I just wanted to show, when we look at those priorities, the different programs, again, to give you an idea that we have going on in and around the area, and I'll just go through this very quickly, and we can always share more of this later to bring that together. And what I wanted to get to, so we have the health needs assessment, and what do you do with the health needs assessment if there isn't actual work to be done? So we're looking at, and I'm going to, and this is something I think when you're looking at the process you're doing here at St. John's, when you look at what you want in the middle, what are the different health priorities, the areas of expertise, the evidence-based programming around it, and that target population that you want to focus on to make that formula. And so I brought to, and you'll see this, the actual report of our health needs assessment, so I won't go into a lot of the detail, but what I did want to share is that we do have an implementation plan, and this might be the next step of where you're going with your assessment. As you see here, this is the plan, and this is life, right? and we realize this, and so there's time to get through, and you might have to switch course. And I'm not going again to go into the detail, but I just want to share with you the different and in the excruciating detail of the plans that we're making to address the health priorities. And I give this more as an example when you're looking at your own template of deciding how you approach community engagement and prioritizing. So it's a lot of good work that goes into that. And I think when we look at that road to success, right, it's always under construction, which is very much a part of the work. And then again, just when we look at those interventions, what is that visual? Comes with all different age groups, with all different ethnicities, with many different stakeholders who bring that area of expertise to leverage and bring those resources together. If you'll see, from the little ones, and I know St. John's does an amazing job of working in the fundraisers, with the trips every year, with the youth, getting our youth involved and starting when they're, this high, because they are our future. And so having from, age 0 to 120 is a good way to start the work, right? Because everyone has something to give, and this is it. This is what we're working for. I think all of us, to have a community that's healthy, happy, and strong. And these are 3 gentlemen from our Senior Shape exercise class who really give us the motivation to keep doing what we're doing. So I'll go ahead and stop there as a little bit of a backdrop to our conversation. I hope that was helpful. Thanks.
Thank you. That was great. Please.
Just,
this way.
Oh, I'm like, I'll just.
Okay.
Come on in. Here I go. Yay. Sorry about
Bravo. Okay, please.
I'm all for, the quick way.
The quick way. Keep people out of hospitals. Come on, fall prevention. Well, thank you so much for setting the stage for a great discussion. There's so many directions we could go with this, but I would like to keep in mind that St. John's is looking at understanding the needs in the community, the unidentified needs, and ways that we can engage to address them. So with that as a backdrop, you talked about the aging population, so I'd like to drill down a little bit on that. We talked about, but it didn't come out in the presentation, the uninsured, the undocumented, the lower income groups, and that's a big part of the need in this community as well, right?
Yes.
And then we also talked a little bit about behavioral health, which is a problem that you said stretches across all socioeconomic groups and is a growing problem. So those 3 things, maybe we can drill down on a little bit and then go to questions. But let's talk just briefly about what you're doing with the aging population, because there's so many things that you have available that we should know about.
So the reason why I wanted to share the slides is to give that backdrop of so much of our focus in community health and wellness, and when we look at health improvement, is around our aging population. Really, I would say is how we approach that is something that we've been doing for a long time, but then we're I'd say moving on new levels of innovation. I'll talk to you a little bit about villages, which many of you, I'm sure,
we had a speaker on villages, right?
Can probably share some things with me. But looking at how we keep our community and our aging population healthy and well. One I had shared with Anne a story. My first year working at Suburban in community health, I received a call from another hospital, our friends at Holy Cross. And I will say that we work very closely with the other Montgomery County hospitals, and you have to if you're really going to do this work. So working collaboratively. And the call was, Monique, we have this exercise class in Clara Barton, but the participants say that you're the closest hospital and they want you to come in and run this program. And I said, okay, well, so we made that exchange, and there was the birth of what we call Senior Shape, and from where these 3 handsome men are spending a few days of their week. And we started with 1 class, and I had mentioned to Anne, I said, the room where many of our exercise class take place look just like this, where you have to put the chairs and tables away and folks exercise, you have to do what you have to do. And folks were sitting in chairs, and they were doing this, and they were doing this. And now the chairs have disappeared. There are mats on the ground. There are weights. There are exercise bands. And they're doing Pilates and yoga. And on snow days, when the center is closed by Montgomery County, they call and complain and say, why can't they have class anyway? So that is, and that is expanded. We have now about 10 different Senior Shape exercise classes operating, both actually in Montgomery and Prince George's County as part of our outreach. And the idea is that you start with in each class, they focus on aerobics, others focus on strength and flexibility. Some have the exercise balls, and they're doing a lot of balance. And why? There are several reasons why. The strength, flexibility, and balance is essential for avoiding falls, for ensuring that folks have independence. If you drop something and pick it up, that could be, if someone falls, could be a hip replacement, which could then be outcomes that are far different from what that individual thought their morning started. So the whole idea is, how do we avoid that? And then, as folks are able to get around better, they're going to go more places, they're going to do more things, and you have a different perspective. And, go ahead.
Yeah, no, I was going to say, how that's for people who know about those programs, but you also mentioned that there's this problem of the isolated population,
yes,
right? How
yes.
do you, can you describe that and how you
Sure,
reach out to them?
Sure. And so, yes, you have an example like Senior Shape, where folks are coming out, and let's say we have them in, and that's where we want them to be, the ideal, so we can take care of them. And then there are other groups of our aging population, or in general, those who may be, as we say, isolated, and that could be, I say, little Miss Betty Smith, and I use the example, who is at one of these high rises on Connecticut Avenue, and she's by herself, and she has 3 lovely children who have no idea that she has not been out of her apartment for 3 weeks, and has nothing in the refrigerator, isn't taking her medication, and may have already taken a fall. And what happens is there's a health crisis in the making. And you take something like that and you compare it with one of our newly arrived individuals who may be new to the county, new to the United States, who is also isolated. And Miss Betty Smith, she's doing okay. She's planned her retirement. She has good health insurance, but still she's not getting the help she needs. But then there are those who are uninsured, who do not have access to health insurance, or don't have a family member here to help them, because they may be scared that it may interrupt their status, may interrupt their ability to lead a life that they want to, that they are looking to change. And what I refer to is those who may be with our undocumented or vulnerable populations. And so you have two, whether we're looking at aging and isolation to isolation and those who are vulnerable, it all, each one has their own challenge of how we might approach working with these individuals. So what does that mean? It means we have to take ourselves on the street. We have to knock on doors. We have to ask people questions. And that's what we're doing and working with many now, for instance, with our aging population, where might not be coming out to us. We're going to them where they live at many of the different senior.
How do you do that?
So phone calls and friends. And as I talk about our relationship with both the county and the other hospitals, we come together. Right now there's actually an initiative called Nexus Montgomery that focuses on our isolated seniors in places where they're living, specifically focusing on the older adult building communities. One is very close right here at Waverly House, right on East-West Highway. There's one at Lakeview House. There's Victory Housing. There are many of the senior buildings sprinkled all over the county, where we are actually going and working with those resident counselors and asking who are individuals where we might be able to have that friendly introduction with them, to just start having a conversation and finding out, and they can decide whether they want to participate, whether they want to be a part of Nexus Montgomery and our work with.
Are these volunteers who do that, or staff?
It's a mixture. With the initiative of Nexus Montgomery, that they are actually work within the county and work with Nexus Montgomery, and there's funding to do that. And generally you do want to have an organized approach to be able then to have that referral back, to be able to have the resources in place to do something. So most of that is actually well organized and has some kind of infrastructure around it.
And how about the uninsured and undocumented population? What can you tell us about that you serve and how you serve them?
Sure. So there are many different, at a larger level, and again going back to how we work with individuals through our county networks, whether it's the Latino Health Initiative, the African American Health Program, the Asian American Health Program. These are established communities where they also have great links to community leaders, where we can work through and reach many of the vulnerable populations in our county. Others are through our safety net clinics, where we actually find those who might be seeking or need medical care but do not have health insurance as an option, and where, let's say, they come for a clinic visit and then we take that relationship up, you know, and strengthen it.
What is a safety net clinic? And then we're
Sure.
going to go to questions brief, but I want
Sure, sure. A safety net clinic, and there are many, you know, are the networks that are set up in the county where specifically for the safety net clinics that we have that are either have a sliding scale reduced fee to visit, or if eligible, you would receive care for free. And there are a multitude. We work very closely with Mobile Medical Care, with Clínica Proyecto Salud and Wheaton, and we'll soon, we're looking forward to working with Mary Center, which also has clinics both in Maryland and Washington, D.C. But there are many. There are about 10 different safety net clinic networks, and then they have several. There's Community Ministries of Rockville, and all of them do, and then even the clinics that Spanish Catholic charities and centers has. And so the networks abound, but we work specifically, you know, as folks come in who may not have that ability to pay for service, an eligibility process that would allow them to have free care. And we had talked a little bit about some of the specialty clinics in heart and diabetes that we have that I can share more details later.
Okay. And do you want to say one word on the behavioral health, substance abuse and addiction problem?
Sure.
And then we'll go to questions.
So I had talked to Anne earlier. One of the, and you had seen those circles, the different percentages. Behavioral health, I would say, is fastest growing really in our area.
Fastest growing challenge.
Growing challenge, issue that we're working with, and also across all ages and socioeconomic backgrounds. At our hospital, we have seen so many incidences of different pieces from addiction to behavioral health, and also in all ages. When you have an elementary school child who no longer wants to be with us, you know, you think what could be going on in their world
You said you had 10 and 11-year-olds on suicide watch,
Yes.
for example. Why is this happening?
Why is this happening? It's a great deal of concern. And then also when you look at the access, and this is one of the great challenges and benefits of our county, there are many individuals who have access to additional resources that may give them the ability to experiment more with different kinds of substances. And we have my colleague, Beth Kane-Davidson, goes out on a regular basis speaking to parents in high schools about these different issues that are going on. And so the idea is, you know, how do you work with different populations? Because what may be happening for behavioral health with a senior might be different with someone who might have an addiction issue, which might be different from maybe bullying that's going on at school that's causing this young person to have real challenges. And so there aren't as many answers as there are questions, and I think when you look at how do you tackle this, I would say this is where we are looking and focusing on how we really do leverage our resources to be able to reach these communities the most, because that would be something that we'll see over and over, let's say back in the emergency department or in facilities. You really have to stick with individuals if you want to really handhold and get them through and figure out how to get them through a process of health.
Into some
with behavioral
sustainable
health.
path.
Yes.
Yeah.
You know, there are many different, with a chronic disease where there might be a treatment
Do you have
that
the
you have,
microphone?
but behavioral health can be far more challenging.
Great. Well, thank you so much, and let's use the rest of the time for questions. That's a huge problem.
Hi. Looking at your data, I see there's another component to this which maybe isn't necessarily the concern of Suburban Hospital, but that is to lift people economically automatically seems to lift a lot of these health outcomes, probably through better nutrition, just generally better education. And I just think in thinking about all of this, it may be something that St. John's gets involved with in some way, whether it's helping people get their GEDs, or, it might necessarily be here, but we might, through support, both money and volunteer activity, be helping with English as a second language somewhere where it's easy for people to get to. Anyway.
Right, the correlation between the health needs and the socioeconomic
Absolutely.
issues is really striking. So, yeah.
Very good point.
Can you talk a little bit about the ways you measure success? It seems like that would be a really important part of this process for us. Also, my question was, there was a lot of self-reporting in your needs assessment. Did that correspond to what you actually see in the ED? And
So I'll start with the latter part of the question. It does correlate with the chronic disease pieces. What surprised me the most of that data is that people say that they don't feel that they're at risk, and especially with the population that we were surveying,
Right.
Because we did target vulnerable areas of our county to collect that information when we approached individuals. And many of those surveys were done actually in Spanish to make sure, as we were looking, with some of our day workers. So I think for many people, something isn't wrong until something, is wrong with their body, or something hurts a family member, a diagnosis. And until then, everything is okay, or I'm going to work, I'm, buying the groceries, we have this routine and everything is okay. So I had mentioned earlier with the percentage of behavioral health and the percentage of those individuals who say that there is not as much, they don't feel that their health is at risk. I said, maybe that is the correlation. Sometimes just admitting or coming to the conclusion, having the time to think, and put all the pieces. And I think in our society, we don't have a lot of time to have those reflective moments. And again, a great place where individuals here at St. John's, I think they're, when you can, assess all of these things, or someone measures their health by the fact that they just have a job, or can pay their rent, but they're not looking. So that's one piece of it that to me was surprising about the data. And then I have to go back, I think you had asked ways to measure success. Mm-hmm. Is that correct?
Yeah.
Okay. Ways to measure success can sometimes be also a challenge, which is why I tried to set that framework where you have to really narrow down and say, who are the individuals, or what is the focal point that we're going to have, and where did we start and where did we end, and how long are we willing to kind of say that 3 to 5 year mark to say what has changed and that percentage. So whether it is a matter of for the English language, maybe having English as a second language, of being able to measure what's a percentage of vocabulary that someone has, or the fact that they were able to get their first job based on the fact that they had this class. That could be a check mark of how you measure success. There are certainly other indicators as well. For us, we might look at a building where we're taking blood pressures, and where 50% have a very high blood pressure rate. Within that 6 month to a year to 2 year mark, we watch that rate go down based on education, training, and really coaching to be able to get those numbers down. So I give that as an example of being able to measure success. To the point of where one of the places where we go, I won't mention any names, we're saying, well, maybe we don't need to be here anymore. And that's the next thing. Once you've done this work, to kind of step back, sometimes it's hard, because you're like, oh no, we've put ourselves out of business, but that's our goal, is to put ourselves out of business.
Right. Other questions?
Yeah, I live in Friendship Heights, and you talked about the isolated older community, and Friendship Heights Village has a lot of older people, and I know y'all come and do blood pressure there. And I was just curious, because the places you talked about, people going and seeing them, those are places that are sort of monitored senior living, aren't they? Like the Waverly House?
They are.
And so what do you do in private residence where
Right,
you
yeah.
don't have that sort of reason to go beat on their door?
So you mentioned the word that I didn't mention, and one is working with the network of villages
Yeah.
in Montgomery County. And I know that there's the village of Friendship Heights, but there's also a Friendship Heights village, I believe, that's forming.
They're forming it, yeah.
Neighbor, and does everyone here know what a village is?
Not everybody came to that
So
presentation.
I will give the loose definition, and anyone else can chime in. One, I've learned that once you've seen one village, you've seen one village. Every village is different, and it really is in its entirety neighbors helping neighbors to stay home and to be well, and specifically for those who may be aging, to be able to live in their homes longer. And villages range from anywhere from having like someone to come and change a light bulb, to having a network of folks who you can trust to come and shovel your driveway, to work in your home, to having someone who might be coming home from the hospital to have some folks waiting there to make sure that there's food in the refrigerator and that the trash is down at the corner for trash day. So every single one is different. But they are really blossoming all over Montgomery County. In particular for our hospital, many of them are very close by. And because it is voluntary, as far as how we work with the villages, there's an incredible opportunity for education and training. And so what we're working right now, what we call the Village Ambassador Alliance with the hospital, is to be able to set up different trainings in neighborhoods, whether that be from CPR to any kind of health topic that folks want to learn more about, to how do you just pick up the phone to the hospital and get a live voice, like who are those real networks, or to be able to maybe call that a loved one is on the way, to other resources that might be needed, to even assessing whether someone might really need to have the day when they shouldn't be at home by themselves, because sometimes those are hard conversations to have.
So you're reaching out through the village network
Yes.
to tap into those
Working
populations.
through, yes. And then at different, I didn't talk about Oasis. I brought some catalogs along. When you think about ways, you're starting to, so Oasis is one of our lifelong learning initiatives that we do in partnership with the Oasis Institute and the hospital, that is lifelong learning after 50. And there are ways, so if people are coming and you take different classes, anything from the cultural arts, museums, to travel, to you name it, it's a great way to stay connected with our community, again, before something happens or takes place. So it really is about the building the relationship before you
There
really
are some
need
brochures
something.
about Oasis here, and what's really interesting is that it builds a community and a network of relationships in the context of people doing
Yes.
interesting, stimulating activities and studies. But it builds a network of people who can help each other and do help each other. So
And it ends up, whether you're taking a class, it could then be that, new best friend that you have when something difficult in life happens that you would have never had before.
Right.
So much of when you comes right down to it, everything that we do is around prevention, and it's having that infrastructure in place, social infrastructure, if you will, before and for the good times. So when something that might be tricky, challenging, uncomfortable come up, that it's really a phone call or a conversation and a link. We're nothing more really than a link to many other resources, and really the message is that the more that we each as organizations in the community hone our skills to do what we do best, and then bring those together around a community, an individual, an issue, that's really a way we take that to the next level, to be able to say, we've got this. And knowing, and I think that is really worth its weight in gold. And I think all along that has, in many ways, set Montgomery County apart from many other places in the country, because I'm sitting here with you today. I'm sure I'm going to run into you somewhere else, and it's great to have that familiarity. And so whether you're in a church, in a parish, a place of worship, whether you're in your child's school or at a neighborhood gathering, it all comes together. And that's what I really love the most about working in community health improvement.
Well, thank you for a wonderful presentation, and those connections are exactly what we're seeking to make. So we'll think hard about ways that we can connect with Suburban too. Thank you, Monique. Thank you.
Thanks to all of you.